Sertraline is one of the most commonly used medications for postpartum depression, and there's a lot of discussion about whether you can or cannot use it during breastfeeding. So we wanted to answer that question today. I'm Dr. Nichelle Haynes.
I'm Dr. Kristin Lasseter.
And we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and fertility.
Let's get into it.
Yeah, Sertraline, which brand name?
Zoloft. Yeah, in the United States. I don't know if it has a different name other places.
I don't either.
Yeah, we had a lot of viewers from Germany recently, so I don't know what they call it there.
I don't either.
Okay, so treating postpartum depression is really important. I want to give that caveat. And I also think...
And postpartum anxiety.
Yes, of course. And I think this is one of the times where we talk about the totality of the evidence, right? That we have numerous studies, and you hear us all the time talking about, like, we don't have a ton of information. Well, that's not necessarily true for sertraline, which is reassuring because the vast majority of the studies are reassuring for sertraline's use in breastfeeding.
Yes, we have a ton of research with this medication and breastfeeding, so we can confidently say, yay, the following things.
Yes. Okay, so we think about maternal levels, or infant levels, right? We think about relative infant dose.
Which
means the amount that the baby gets in relation to the amount that the mother is taking, weight adjusted.
Yeah. So in general, with medications, they're considered compatible with breastfeeding, just like across the board with medications, not just psychiatric medications, if they're less than 10%, if the relative infant dose is less than 10%. And so with sertraline, it's
anywhere between about 0.5%, like 0.5%, to about 2.5%, which I think that's on the high end because the vast majority of the things that I was able to find was about 1%, 0.6, 1%, something like that.
Yeah,
which is really reassuring and really great. And I actually saw one study that showed that the amount that the baby was getting did not have a correlation or wasn't related to the amount that the mom was getting. And that was still a very low amount.
When I was in training, was taught that if mom is taking a low amount of sertraline, it's not even detectable in the breast milk. And so even if you're on a really high dose, it's still like such a tiny amount in the breast milk that the amount that's actually going through to infant is very small.
And to add another layer there is, right, okay, you have the amount mom is taking, the amount that's present in the breast milk, and then that amount is different from the amount that actually gets to the baby, rather than
in their bloodstream.
Right? So that amount is like very, very, very minimal, and that's very reassuring. So even the amount that we do see that gets to baby, we don't have pretty much any data to support that that's really harmful for babies, other than there are a couple of very rare instances where a baby doesn't have the more common version of the enzyme that breaks it down, right? So it would build up in the baby system and could cause potential problems, but I think there's like one case report of that ever.
Yeah, so most babies tolerate this very well in breastfeeding. With any breastfeeding, while you're taking a medication or a new supplement, anything like that, you just want to watch the baby for any changes. So, and if there is anything going on, like I think for sertraline, maybe watching for like irritability or baby being a little bit more sedated, you just want to bring that up to your pediatrician.
Yeah. You say more sedated. There's actually one case report of a baby having difficulty with not sleeping very well, or like not being able to fall asleep when the mom was on sertraline, and that resolved after she stopped it. So you could watch for changes in sleep for baby, but baby sleep changes all the time anyway. So I don't know if they're going to do that. But I would say that for this medication specifically, we feel very comfortable with breastfeeding on this medication.
In fact, if somebody comes to us with postpartum depression or postpartum anxiety and they've never taken any kind of medication before, they didn't take anything in pregnancy, this is often the first line medication that we will go to in prescribing for somebody suffering with postpartum depression and postpartum anxiety. And it's so important, absolutely, absolutely important to treat postpartum depression and postpartum anxiety. And breastfeeding has so many benefits too. So we would not recommend for the vast majority of people, of course, everybody's case is different, but for the vast majority of people, you wouldn't recommend discontinuing breastfeeding to start this medication.
Or just because of the medication.
Right.
Right. That if they want to and they're like, this is so draining on me, I can't manage it, then of course that's a separate discussion. But I usually say something along the lines of this medication by itself is not the sole reason that we would not recommend you breastfeeding for whatever reason. Yeah. And then of course there are, some places that will say like, oh, take your medicine and pump and dump afterwards. We do not recommend doing that. It only decreases the infant's daily dose of what they receive by 17%, even if you're doing it at the peak time the medicine is in the breast milk. So that's liquid gold I should take.
Which you also don't know for everyone. Like everybody kind of metabolizes medications a little bit differently. You can't exactly tell when somebody's peak time of a medication. You can say on average.
On average, yeah.
But that might not be true for a particular person.
Yeah.
But talk to your own doctor.
Of course, yes. But this is one of those things where we're like, this is very likely less risky than postpartum depression or anxiety experiencing.
100%. We know that postpartum depression and postpartum anxiety is risky for the mom, obviously, but also for the infant. It has changes and risks associated with their growth and their development and their emotional well-being. So it's not something to be neglected.
Yeah, we have a whole video on that. I can link it in the comments for you to go directly to that. But yeah, sertraline during breastfeeding, we give it a thumbs up for the vast majority of cases. Of course, talk to your doctor. Thank you so much for being here. Please like, comment, subscribe. We'll see you soon.
Bye.